Hello and welcome to LociMania and IRDS, which is Infant Respiratory Distress Syndrome, also called Neonatal Respiratory Distress Syndrome. So let's go to the definition. You have problems with the alveoli because they collapse in order because the surfactant deficiency, and you have a hyaline membrane formation around the alveoli, which is a waxy pink-like membrane histologically, and this impairs the gas exchange. Then you have symptoms in the infant, which is dyspnea, tachypnea, and cyanosis. In more severe cases, you can see fatigue, apnea, and hypoxia. And hypoxia is less oxygen in the tissues of the body, and this is all because of the gas exchange, which is impaired. So remember this one, the gas exchange is very impaired in IRDS. And dyspnea, tachypnea, difficulty breathing, and a rapid shallow breathing rate is the symptoms of infant respiratory distress syndrome. Going on to the causes and complication of IRDS, you can see that you have prematurity, maternal diabetes mellitus, maternal narcotic addiction, C-section complication, and also PCD, which is primary ciliary dyskinesia, a very rare genetic disease that some infants could have. When it comes to prematurity, it's caused by surfactant deficiency. So in the fetus, between week 24 and 28, the fetus starts to develop its surfactants, and by week 35, usually that development is complete. So over half of the children which are born before week 28 will have a problem with the surfactants, that they are not fully developed. Coming to the complications, the infant could have patent ductus arteriosus, which is PDA, and a necrotizing enterocolitis. And going on to our mnemonic for this topic, I call it PCD, which is the rare genetic disease, but it's very helpful because it helps us remember four causes of this disease. So P for prematurity, C for C-section, and D for diabetic mother. So PCD, and the PCD itself is the primary ciliary dyskinesia, and PCD for the prematurity, C-section, diabetic mother. Going on to diagnosis and treatment, you will need to do a blood gases analysis to check the oxygen levels and see if there is any excess acid in the body fluids or any infections. You do a pulse oximetry test to, the little thing you put on the fingertip or air tip. On the infant, you put it on their feet and check for the saturation. And you do a chest x-ray where you should see a cloudy appearance on one of the lungs, which you can see here on my little cloud that I've drawn up, which is beautiful and very descriptive in my opinion. You have a treatment, which is oxygen supplementation, of course. Betamethasone, which is a steroid medication you give preterm labor mother, and this is to speed up the development of the baby's lungs. And then lastly, the echocardiogram. This you do it because you need to see if the complication patent ductus arteriosus have occurred or not. And that will be everything for IRDS. Thank you very much, and see you next time.